Hey guys, welcome back to Follow Me 11B. Discussions on current events, macroeconomics, and freedom and liberty from a veteran's perspective. Today I would like to talk CDC and how they have recently relaxed some of their pandemic-related requirements, shall we say. Also, were the requirements, particularly with masking, effective ever? Or was this a complete waste of time and resources? Let's start off with an article from the New York Times published January 14th and updated January 27th. Surprisingly and strangely, without listing an author. However, it is entitled Illness Updates. CDC says cloth masks are not as effective as others. Duh. CDC concedes that cloth masks do not protect against the virus as effectively as other masks. Like, we needed the CDC to tell us that. Most people are fully aware that N95 masks, you walk into a grocery store with an N95 mask, suction cup to your face with two super tight rubber bands, is way more effective than somebody walking in with a red bandana like they're about to rob a bank in the Old West. But apparently we needed the CDC to tell us that. I'm just happy that they finally fessed up and came clean. All right, moving on to the next article from Fox News, February 10th, 2022, entitled Democrats Scramble to Reverse Course on Illness Restrictions Ahead of Midterms. It's by Jessica Chasmar. Democrats across the country are scrambling to reverse course on illness restrictions as this year's midterm elections loom. With the notable exception of the White House, Democrats at every level are signaling their support for returning to normal as polls show that Americans are weary of illness restrictions, which Republican states have largely done away with. According to a recent poll by Monmouth University, 70% of Americans say it's time for the country to move on from the pandemic. President Biden's approval ratings on handling the illness are also now underwater, with 43% approving and 53% disapproving, according to the poll. Now, I'm not a political pollster, but I'd be willing to bet that if 70% of Americans say it's time for the country to move on and they don't like that policy, and 53% are disapproving of the way the president himself is handling the whole illness problem, the Democratic Party in general is probably in like DEFCON whatever right now, in full-on panic mode. And that is illustrated by the next couple of paragraphs here. But with the midterms ahead, many Democrats who once led the way on issuing lockdown orders and mandates over the course of the pandemic are easing restrictions in their states in defiance of the administration. That's weird. Numerous blue state governors this week have announced that they are rolling back illness restrictions. Duplicity in politics. It's still a thing. All right, let's move on to the final article from CNBC, published Friday, February 25th by Spencer Kimball. Keep in mind, first article on masking, not as effective, January 14th. Second article was from, let's see here, it was from February 10th on Democrats scrambling to reverse course. And this is from February 25th. CNBC, CDC relaxes illness guidance, allowing most people to ditch masks if hospitalizations remain low. The Centers for Disease Control and Prevention relaxed its mask guidance on Friday, allowing most people to ditch their face coverings as long as illness hospitalizations in their communities remain low. More than 70% of Americans live in communities where wearing masks is no longer recommended under the new CDC guidelines because hospitals are not under severe threat from disease there. Now, FYI, if I were a politician, a national politician that was having sinking poll numbers and my whole party was heading for a complete and total disaster in the midterm elections because of unpopular national policies, relaxing unpopular restrictions on 70% of America, voting Americans, would probably be one strategy that I could get behind to try to turn things around. The CDC's new focus on the impact of severe disease on hospitals marks a significant shift away from the agency's previous use of illness infections as the key metric in issuing public health guidance. With widespread population immunity, the overall risk of severe disease is now generally lower, Dr. Rochelle Walensky, director of the Center for Disease Control and Prevention, told reporters during a call on Friday. This updated approach focuses on directing our prevention efforts towards protecting people of high risk for severe illness and protecting hospitals and healthcare systems from being overwhelmed. This is my favorite part. And by favorite, if you watch my videos, you'll know that it's the most absurd part of the whole article, or all three articles. People can check whether masks are recommended for their county at the CDC's website. Under a color-coded system, people who live in green counties with low illness levels do not need to wear masks. People who are at high risk and live in yellow counties where there's a medium illness level should consult with their doctor about wearing a mask. Hello, Doc. This is Andy. I was wondering if, I noticed I'm living in a yellow county. Is it okay if I don't wear a mask, or should I wear a mask? What do you mean it's up to me? Hello? Hello? People who live in red counties with high illness levels should wear masks in indoor public places and schools. And last but not least, I'm not even going to get into it, but this is the color-coded system that the government came up with. It kind of reminds me of during the 9/11 days when they had the color-coded terror system where if it was red, you better not leave your house. It's terrorists out around every corner. If it was, orange, then if you do go out, wear a bulletproof vest. If it was yellow, make sure you got eyes in the back of your head, and if your neighbor's doing anything weird, make sure you call the cops and phone it into them immediately. If it's green, just business as usual. Nothing to see here, people. But again, first article, January 14th. Last article was the 25th of February, and the one before that was, I believe, the 10th of February. But the State of the Union address was March 1st. So kind of weird how the science changed and the restrictions were loosened, and the State of the Union went off without a hitch. Nobody had to wear a mask. If you did it a couple weeks ago, everybody'd have to wear masks. But you do it now, everything is A-okay. Not only is it A-okay, but now that we're loosening restrictions, hey, also by coincidence, the midterm elections are coming up soon, and they've loosened restrictions on 70% of the population, on 70% of the voting population for draconian policies that I think the number actually was also 70% of the public does not support anymore. So thought that was interesting that the duplicitousness of politicians seems to be in full effect for everyone to view once again. But some things never change. So that's all for now. I will see you soon in the next video. In the meantime, don't forget to subscribe to this channel and like and follow us on Facebook and Twitter at FollowMe11B. And The Real Follow Me 11B on Instagram. And we will see you all on the next video.